examining donkeys. Donkeys are designed to live in harsh environments, having very little food that wouldn't necessarily be very nutritious. A lot of exercise would be required to search for their vegetation, meaning they would walk up to 16 hours each day. They are living in areas that are full of nutritious and lush grasses. They will put on weight and excess fat reserves. If they, for any reason, stop eating, hyperlipaemia may develop, which can potentially be fatal. What is it? It is a condition or illness caused when donkeys stop eating, known as negative energy balance. This is when there is more energy being used up than taken in. Essential organs still need a food supply, therefore the body will try and use energy that is stored as fat deposits. Fatty acids are then dispersed to the liver to produce the glucose needed to provide the donkey with energy. Donkeys and small ponies are unable to turn off the fat release, which is controlled via hormones, resulting in a large build-up of fat within the blood. The fat content within the blood can be measured in triglycerides by a veterinarian. The veterinarian will take a blood sample that he or she is able to examine by eye. This can only be done once the red blood cells have settled so that the fat is visible. The large amount of fat that builds up in the blood causes liver and kidney failure, an irreversible organ damage that will end in death. Clinical signs. Change in behaviour. It is important to know your donkey's personality so that a behavioural change can be spotted very quickly. Bad breath, decreased appetite, decrease in production of faeces, ventral oedemia, which is a build-up of fluid in the body's tissues, symptoms of kidney and liver failure, such as head pressing, ataxia, which is a lack of voluntary coordination of the muscles. They will be lethargic, and they will also have seizures before resulting in death. Prevention is much better than cure, so make sure that your donkey isn't any of the following: overweight, especially when pregnant or lactating; stressed, which can be caused by many things such as loss of companion, transportation, or change in diet; underweight, outside in bad weather, so make sure a shelter is provided; cold, place rugs on if they are old or underweight. Causes of hyperlipaemia: pain, loss of companion, let them grieve for their companions if they've died or anything; transportation, social mixing, bad weather, sudden decrease in weight, sudden dietary changes, so change anything very gradually. Treatment: aim is to reverse the negative energy balance. This can be done by encouraging your donkey to eat yourself, giving them any sweet treats or anything that they like to try and encourage this. However, if this doesn't work, the veterinarian could try true feeds and intravenous fluids. Anti-inflammatory medication and antibiotics also may be given. My references.